afternoon. I'm Matt Cowles, Deputy Director for NEMA, and welcome to the sixth installment of NEMA's Virtual Learning Lab. We're excited to continue this series of webinars that have proven to be informative and allow us to share experiences. And now it's my pleasure to introduce a NEMA fixture, a former state director and NEMA president, and the man who made the only known reference to potato salad during a congressional hearing once, Brian Kuhn of IEM.
Thank you, Matt. Good to be here today. I'd forgotten that one. Let's see what I can come up with today. Great to be here. I am in the Virginia State Emergency Operations Center today, where I am assisting the state in standing up some vaccine sites across the Commonwealth. I'm currently in the Joint Information Center, which is why I'm able to be maskless. I'm the only one in the room here. Matt, thanks for being here. Everybody, great to see you all. We've got a terrific conversation going today, an important conversation on diversity, equity, and inclusion in emergency management and Homeland Security. You know, as many of you know, emergency management as a field struggles with diversity and inclusion. That has been highlighted by the COVID-19 pandemic. It is highlighted the existing inequities in emergency response and recovery at every level of government. In almost every state, African Americans have died from COVID-19 at a rate that is higher than their representation in state population. And so conversations are also happening across the country about equity in regard to the public health and medical response to COVID. So for this session, we will touch on COVID throughout as our panelists talk about or highlight their recent experiences. But what we really want to focus is on emergency management and disaster recovery. As scholars and experts in the field examine disaster recovery, whether wildfire, flooding, or severe storms like we've had yesterday and continuing today, underserved communities face more daunting challenges to recover following a disaster. In November 2020, just a few months ago, FEMA's National Advisory Council issued a report to then Administrator Gaynor confronting the issue of equity in emergency management. Their conclusion was that a successful and effective emergency management response must focus on equity, outcomes, and coordination. The report also found that in the wake of a disaster, FEMA programs disproportionately benefit affluent individuals and communities, leaving lower income individuals and communities to sink further into poverty after disasters. The report also cited that FEMA assistance has historically been provided to people, municipalities, tribes, and states with the pre-existing resources able to navigate the complexities of FEMA and can afford to pay the required 25% cost match. The NAC further advised that FEMA develop an equity standard and dramatically change the way the agency prioritizes funding and allocating resources. Since FEMA has acknowledged this disparity, and agency officials have said they want to improve disaster response and recovery programs to better support low-income and minority populations. Just this week, there have been articles in Scientific America and E&E that said they want to do better on equity, specifically, quote, through internal emails, public advisories, and virtual seminars. FEMA acknowledged that disaster and recovery programs unfairly burden low-income and minority populations, end quote. In February, FEMA's Office of Equal Rights published an advisory telling states and other disaster aid recipients that they should routinely consider the needs of all the populations they serve, including racial, ethnic, and limited English proficient communities, as well as individuals with disabilities, to ensure compliance with federal civil rights laws. Just this past month, FEMA established a civil rights advisory group to identify and eliminate inequities and who gets inoculated. Recent studies have also pointed out the inequities in disaster response and recovery. A December 2020 report from the Resources for the Future, focused on wildfire response, noted that communities with higher socioeconomic status receive more local public goods when they experience a shock in demand. Also, forest managers are more likely to implement fuels projects near communities that have recently experienced a fire when those communities have a higher percentage of high income, high education, and white residents. Today, we plan to explore some ideas and solutions to these issues and concerns and have a fruitful conversation regarding what steps FEMA needs to take to improve equity in its programs, some of which might require congressional action. We also want to talk about what we can do at the state, local, tribal, and territorial level to improve the outcome for all disaster survivors and also improve diversity in the field of emergency management. Today, we will hear from a distinguished panel on what they have seen in their careers, how they have worked to address diversity and equity issues, and what they foresee for the future of emergency management and disaster response and recovery from an equity lens. We hope that you will leave this conversation inspired and with some useful lessons learned or best practices that you can implement in your agency or jurisdiction. Please join me in welcoming our panelists who have been on the front line working to make changes. We have 4 terrific panelists. First is Chauncey Willis, co-founder and CEO of the Institute for Diversity and Inclusion in Emergency Management. We have Patrick Sheehan, director of the Tennessee Emergency Management Agency. Francisco Sanchez Jr., Deputy Emergency Management Coordinator, Harris County, Texas Office of Homeland Security and Emergency Management. And Gloria Steele, Language and Communications Strategy Manager, Fairfax County, Virginia's Office of Public Affairs. We're going to give a short bio for each of them and allow them to speak for a few moments about what we have addressed thus far in their perspective. I'm going to do the bios before each individual speaks so that you can better put it next to when they go. And so without further ado, we will get started. This is going to be a dialogue. Our presenters do not have PowerPoint presentations today. And we will conclude after all 4 speak and do some question and answers. So without further ado, our first guest today is Chauncey Willis. Chauncey is the co-founder and CEO of the Institute for Diversity and Inclusion in Emergency Management. She is a certified emergency manager, professional coach, and cultural diversity professional with over 20 years of experience. Her expertise is in disaster management, national security event planning, leadership coaching, immigrant and refugee outreach, as well as diversity, equity, and inclusion training. Prior to co-founding IDIEM, Chauncey has served as the emergency manager in Tampa, Florida for over 14 years, where she developed successful programs benefiting marginalized population. And she also led national efforts for political conventions, National Football League games, and international award shows. And I spent many quality hours together in EOCs during those events. And in her role as CEO for IDIEM, she leads the effort to integrate equity into all facets of disaster policy, programs, and practice with the goal of increasing cultural competence and mitigating the harmful impacts of bias and underserved groups. So Chauncey, welcome, and the floor is yours.
Thank you so much. And you're right. We spent many a day working different events, and I've always appreciated your guidance and influence as well. You've been such a great friend over these years. I would like to go ahead and get started, and I'm going to start from a place of really a place where I think it will be most relative to this conversation. And as Brian said, we want to make sure this is an open dialogue. So I'm going to start with some comments that I've heard over the years. Why didn't they just leave? Didn't they know a storm was coming? You seem like a nice gal. The best thing you could do is just get in your car and go home and go back to where you came from. Chauncey, that's a bad neighborhood. They told us not to go in there under any circumstances. Leave that neighborhood alone. Whoa. They sent a colored girl for this response? That's interesting. If it was me, I wouldn't give them another red cent. After all they're going to do is buy another 40 ounce with it. Now, those are the words that I've heard throughout my career as an emergency manager. And as an African-American woman who's worked in the space of emergency management for over 22 years, I've been privy to a lot of racist, sexist, elitist, and generally unacceptable conversations. My ears have burned and my heart has broken. And the thing is that these conversations were not had by people I didn't know. In fact, more often than not, these conversations were held by people in positions of privilege and power. They were the words of my fellow emergency managers. So can you imagine? These are the words and perspectives of men and women who have come to assist the most vulnerable people in times of disaster. So for me, when I discuss diversity, equity, and inclusion, and the work that I've done over the last 15 years, specifically in this space, I'm not coming from a place of something that is notional or that I've read in a book. I'm coming from an understanding of what I have witnessed and experienced, the marginalization, the racism, the bias, and the exclusion. I've experienced it personally and I've witnessed it. And it has occurred for no other reason than for being born to a particular station in life, whether you're an immigrant, whether you're a person who is low income, a person of color, a person with accessing functional needs. And this is why diversity and equity are so critical in emergency management. Emergency managers are not taught the value of diversity, equity, and inclusion. And so as a result, those three things are not operationalized within our field. In fact, emergency managers are taught to do the most for the most. And that philosophy of doing the greatest good for the greatest amount is what has led to so many problematic issues within the field of emergency management related to diversity, equity, and inclusion. Unfortunately, doing the most for the most has been used world over to justify inequitable policies that benefit the majority and create programs that favor certain groups over others. Unfortunately, doing the most for the most, doing the greatest good for the greatest number fails to consider the existing inequities and diversity, and it intentionally leaves out underrepresented groups. So as emergency managers, our greatest strength really lies in our ability to plan, in that planning space. Unfortunately, our planning has not evolved to require that existing inequities be considered and addressed first. The enemy of equity is the failure to acknowledge existing inequities. So when we're talking about equity versus equality, equality focuses on sameness or using a uniform approach to find a solution. Think a mass vaccination center. That is an equality-based approach. It is not equitable. Diversity and equity are connected, and to appreciate equity, we must also understand diversity or differences. Diversity is what produces meaningful equity, because you're bringing together different perspectives and experiences that are considered, respected, and incorporated. So as we dialogue today, I'd like to make sure that we're having an open conversation, and I am here to be as transparent as possible on these very important issues. So please definitely ask questions and provide comments. And with that, I'll turn it back over to you, Brian, because I know we have some very, very important guests to get to. Thank you.
Thank you, Antia, and that was a heck of a start. So thank you for kicking us off like that. I'm excited to get to the questions that your presentation are going to generate. So next, our next speaker is Mr. Patrick Sheehan. Patrick is almost at the 5-year point as director of the Tennessee Emergency Management Agency. So congratulations on the upcoming milestone, Patrick. He came to Tennessee after about 12 years or so in the Ohio Emergency Management Agency, the birthplace of emergency managers. During his time there, he had a number of roles. He ended up as the emergency operations as the administrator, the operations administrator, and led the operations center and the radiological and preparedness branches, including dealing with a number of events during that tenure, including Ebola, 2014 drinking water crisis in Toledo, a statewide propane shortage, and a long-term power outage in 2012, then a heat wave impacting 33 counties. He also started the emergency situation and immediate response operations coming from the watch office there in Ohio, and also held roles in the finance staff and other leadership roles in the agency. So obviously you did a great job there in Ohio and were promoted tremendously. So Patrick, welcome, and floor is yours.
Hey, thanks, Brian, and thanks everyone for joining us. And I've had doubts about why, what could I share, compared to, I've had the opportunities to speak and be around Chauncia and Curtis and other leaders in the discussions around diversity, equity, and inclusion. And this week actually kind of served as a reminder to me about why it's important, in that emergency management does not yet reflect the people we serve. And in our nation, there is still too much a discussion about them or others. So the shootings in Atlanta this week, where I grew up in the Atlanta area, and my younger brother's a police officer there in Cherokee County, which was one of the sites. And so it kind of brought it home to me. And I think we have a tendency to reduce people to what we can understand. And people are far more complex than we think they are. We're far more complex than we probably think we are. So we all contain multitudes. So for instance, I am both the son of a Boston Irish U.S. Army infantry colonel and the son of an immigrant who had immigrated to the United States from Korea in 1973. Both of those things are true. They're both part of what make me, me. And I think having a broader mindset like that is something that we need to work on in our profession. When I really hadn't thought much about race or equality or equity in emergency management before my first day at NEMA. And some of our minority staff asked to meet with me, and it was really so they could tell me how surprised they were that someone that they didn't see as white had been appointed as the director of the Tennessee Emergency Management Agency. And that's something, obviously, nearly 5 years later that just really struck me. And, I had looked at our workforce and the demographics around our workforce, and we still, even though we've made progress, we still don't reflect the Tennesseans, the 6.8 million Tennesseans that we serve. And we have a lot of work to do there. We have like a lot of emergency management agencies, like a lot of departments in the state of Tennessee, we're facing a retirement cliff. We have a number of employees who are eligible to retire at any time. That's been true since the day I walked in here. And so one of the things we're trying to do is prepare for the next generation. And so we're working with Tennessee State University, which is a historically Black college, a state university based here in Nashville, Tennessee, on helping to establish a certificate program so that when we have positions available here at NEMA and when we have local emergency management positions available, that there'll be an awareness of what emergency management is and visibility into it as a viable career field. And one of the things I've reflected on here in prepping for this session in the last week is how much language matters, how much the words that we use to describe things matters, how often in my 18 years in emergency management, I heard pronouns like them or those girls or they when referring to someone that was being viewed as not being a part of the emergency management tribe or some core group. And I think that when we do those things, when we let those things go, they echo through time and we continue to live with them. And, as we're working, Brian talked about how much the African-American communities have suffered disproportionately in this pandemic. And I remember in May or June, reading a newspaper article about the one of the states that had a high death rate earlier than we did, and the proportion of them that were African Americans, and just being terrified that was going to be us next. And so we really worked hard on making sure that we were making testing available and care available in those communities early on. We're fortunate here in Tennessee. We have Dr. Kimberly Lamar is the Assistant Commissioner for the Tennessee Department of Health's Office of Equity and Health Disparities Elimination and Minority Outreach. And she's really helped to make sure that we're communicating. We've early on tried to work with community leaders in communities that had SBI scores and low access to health care. And some things that I've observed is that, and Chauncey was talking about this, you know, how we try to do a mass vaccine site. And one of the things that I've learned is that we have to trade speed for access. And I'm someone that talks about speed a lot. Speed's a killer competency, but speed only works where you have a high trust environment and when you have high access. And so many of our communities of color, so many of those that live in poverty don't trust the government. They don't trust state or federal leaders, and they don't oftentimes trust their local leaders. And that lack of trust serves to slow things down. And if you add to that a limited access, whether it's because they don't have access to an automobile or mass transit doesn't work in those communities, those things will serve to slow us down. And so if we're going to have equity in vaccine, if we're going to have equity in care, we're going to have to focus on the fact that equity is important and linger and work shoulder to shoulder with those communities. And that lack of trust, it wasn't earned at one time. That lack of trust was something that eroded since, in some ways, since the founding of our nation. And in some ways, things haven't gotten better. Yeah, though in many ways, lots of things have gotten better. But the fact that some things have gotten better doesn't change the fact that for some of these communities, for some of these Tennesseans, some of our fellow Americans, they still don't have trust. And we've earned that lack of trust. And it doesn't matter if it wasn't me, if it wasn't the teammates that are here at Teamland. It doesn't matter if it was you that are on this webinar or any of our partners that did these things that caused an erosion of trust. The fact of the matter is that we have to deal with it today. And something I've learned over the last 18 years is all of the easy problems have already been solved. And so what's left for us here working today in emergency management and our partners is to solve these hard problems, these complex problems, these problems that have been under the surface and untouched or ignored for all these decades. It's up to us now to solve it. And if we're going to leave an indelible mark of improvement in our nation and in our profession, it's up to us to do it now. Looking forward to the continued discussion here later on, Brian.
Outstanding. Thank you, Patrick. Appreciate those comments. All right. Next up is Mr. Francisco Sanchez Jr. Francisco serves as the Deputy Emergency Management Coordinator for the Harris County Office of Homeland Security and Emergency Management, where he is responsible for disaster and preparedness and response in the nation's third largest county. He joined Harris County in 2004 and was the lead public information officer during the local response to both Hurricanes Katrina and Rita in 2005. He has led the region's Joint Information Center during Hurricane Ike and the highly active 2008 hurricane season. In 2013, he was appointed to the Communications Security Reliability and Interoperability Council, an advisory committee to the FCC offering guidance on key issues such as next generation 911, alerts and warning, and cybersecurity. He is an advocate of integrating emergency public information and joint information center concepts into local emergency response efforts. And he is a member of the Houston Area Urban Security Initiative Regional Collaboration Committee, where he works to build consensus on a variety of measures critical to local preparedness and response capabilities. Francisco, it's all yours.
Great. Thank you, Brian, for that introduction and for clarifying Harris counties in Texas. There's a few Harris counties out there, but it still would be a whole lot easier for me if when they landed on the moon, they would have said Harris County, the eagle has landed, rather than Houston, the eagle has landed. It would make it much more easier to explain where I'm from, but that's where we are in the Houston area. And what a timely discussion. Thanks for putting together the good panel, and it's a worthwhile topic, and I'm looking forward to our discussion later. First and foremost, this is my cornerstone for tackling this issue, and is that diversity is descriptive and inclusion is intentional. Two distinctly different things. And interestingly enough, over the past 2 days leading up to this, to just tell us how much work we've got ahead of us. As y'all know, we just went through a big winter storm here in Texas, the kind we're simply not used to. And I've gone into two of my favorite Mexican restaurants where the wait staff speaks primarily Spanish. And at both restaurants, on both days, someone checked in with me. How are you doing? Checked in with them. And we're not aware that FEMA assistance or local or any assistance, and not just a FEMA issue, that any assistance was available to them. And we've got myself here as a deputy EMC. These are folks that I connect with regularly. Our communications team is primarily minority. Our communications media expert is fluent in Spanish. We've done a lot of outreach, and so just a reminder here locally of how we can continue to do better on some things and on some different levels. In terms of our perspectives within our agency about how we tackle diversity, equity, and inclusion, I think the hiring and promotion of people with different backgrounds and perspectives is critically important. And we try to avoid some of those mistakes that kind of happen in all kinds of places. Automatically thinking of people of color for positions strictly in outreach or preparedness, or sort of those outward facing roles. Hiring men on their potential and women on their experience. Or one of the things that particularly frustrates me is when we got someone recommended for a position and they tell me why there's one person over the other, it's that the person won't fit because they have a different culture than the team. And they mean that just sort of in the perspective on how they tackle some items. Bringing diverse viewpoints to the table, but especially when discussing issues that are disproportionately affecting communities of color, immigrants, the elderly, the disabled, LGBT, women, being as inclusive as we can be in those efforts, but also in appreciating those perspectives and inviting those perspectives in to our team is essential. Being proactively engaged in that is critical. I think for those in our staff and those that are already in emergency management, mentorship, I think, is especially critical in making sure that we make those investments for folks that are already sort of at the table, and making sure we can be proactive in mentoring and giving them the tools to be successful and taking those measures. And I think we have to build it into the process. It's not, I don't think it's good enough that, because I'm here, it's a certain culture. We want that culture to sort of last. But quite frankly, we ought to go beyond that and making sure that it's built into the process. It's baked into into how we do business. Our 3 C's for success here in Harris County are communication, coordination, and collaboration. And while those are critical to what we do, even that, it can't be something that we keep in the back of our minds and try to do. We have to build processes that make that, enforce that communication, coordination, and collaboration. And just how we do that here, we need to do a better job at building that approach to inclusion and diversity into the process, so that we stay on course of that. In terms of how we promote the field of emergency management, and we're starting to see a larger number of emergency managers coming from the academic ranks rather than military or civil service. I think that's leading to a more diverse group. Social science is becoming more important in planning, emergency public information. It is becoming essential to sustaining our emergency management successes. And those leadership positions need to be filled or created with this in mind. And I think we've got some things that are going for us in that regard. Emergency management has gone through some phases. I think there's an aging out, and to some degree of one part of the profession. It started really with the civil defense. Then it moved to what it was transformed to by James Lee Witt. And now I think we're seeing a third evolution in emergency management, where there's more focus on the manager than the emergency part of it. I think that's not just good for the practice, but I think it's good for the profession. And I think those kinds of things that are naturally happening in emergency management will be beneficial in increasing the diversity. In terms of how it impacts preparedness, response, and recovery, all disasters in the end are human events. Looking at Harvey, for example, we got 50 inches of rain, but if that had not impacted people's homes. It could have been, it was still going to be historic, but it wouldn't have been a disaster. In the end, disasters are because they impact people. And we continue to see COVID is just the most recent example in terms how hurricanes and other disasters hit poor people or those that are most vulnerable communities the hardest for various number of reasons. Hurricane Harvey, for example, was, we had 10,000 square miles of a devastating historic flood. It was a 2,000-year rain event in terms of, so it was certainly one for the records here. And Southeast Texas, you had disproportionately of those impacted. 55% of Anglos reported damage, 79% of Hispanics reported damage, and 73% of African Americans reported damage. 1 in 6 affected of those residents say someone in their household has a health condition that is new or worse as a result of Harvey, and nearly 2 in 10 feel that their mental health is worse because of the storm. And now we've been through COVID, and now we've been through some various other storms, and now the winter storm. And part of that, there are things that laid the groundwork for that. And one is how we invested in flood projects. Flood projects, the way they were prioritized, were disadvantageous to people that were already in vulnerable neighborhoods and watersheds that continue to flood. We've got, the formulas that tell us how we're going to invest those flood dollars, whether they be local, state, or federal dollars, that talk about making sure that you try to mitigate those areas that would have the most economic damage. Yet those areas are improved, pushing water to neighborhoods whose home values are less, but it's impacting more people. But because the value of the homes aren't high enough to make its way up the formula. So those kinds of things. And we have to address chronic stressors. That's a core issue, and how why the most vulnerable are perpetually impacted, from education, jobs, and healthcare. Those are the chronic stressors that on the preparedness and resilience side, we need to address to ensure that those folks that are most vulnerable there and already have challenges in accessing those things, that's why they're further impacted in a disaster. So, and we even see now the recovery from the winter storm. Because of COVID, there's virtual registration, there's virtual help, and that is already putting at a disadvantage people that may have have technology gaps. They may not know how to use the technology. They may not have access and need that extra help. So that's a challenge. COVID testing and vaccines, I think we all learned a lot about how that disproportionately puts people on the margins. I think we've gotten better here at Harris County, but you see that, for example, this is one of the things that's has been frustrating for me on the recovery side. The first people to call in for a disaster are those that typically are not impacted as bad. Those that were severely impacted have something else to worry about in the moment. And the technology gaps and those kinds of challenges. But how do we make it more equitable in terms of getting a vaccine? And it's not who can first get to a computer, because chances are they are not those folks that are the most vulnerable in those categories that we have set up. So how do we further change? I think we can't talk about diversity without following up with inclusion. Those communities need to be at the table, but they also need to be at the head of the table in terms of our profession, and we need to be able to foster that kind of growth. And I think we need I think one of the challenges I've seen persistently is a general attitude that, we're doing as best that we can. And we rely on our sort of own internal expertise and thinking maybe that's not important if we hear that from them. And we have to invite folks to be a part of that process. I will, for example, during Hurricane Harvey, the Harris County shelter at NRG, next to NRG Stadium, was humming along. We think we were doing a good job. But a colleague of mine at the mayor's office happened to be the former head of disabilities in the Obama administration, and now actually heads up the National Association for People with Disabilities, wanted to do a walkthrough. And she wanted to critique what we were doing, and she wanted to make sure everything was working fine. So I said, sure, Maria, let's do it. So we popped in, 10:30 at night, did a walkthrough, and we took notes, and we had to overcome a little bit of resistance from our staff saying, well, this is fine, or we're doing that well, but we are not the experts at that. And we need to be more open to the kind of feedback that we get and value it and take it to heart and start moving the ball on that. And we often hire consulting firms to help us with those things that we're struggling with in emergency management or in almost any field. We need to be sure we need to do that here as well, and utilizing those community experts and following their advice and their feedback. So in closing, I'll say we need to build it into our culture in every phase of emergency management, from prevention, mitigation, preparedness, response, and recovery. But I'll close with saying that, quite frankly, there's one thing that's constant, even in this discussion, and even when it comes to equity, that the more we invest upfront in diversity and inclusion on the prevention, mitigation, and preparedness, the less challenged we're going to be in the response and recovery pieces. So that's my 2 cents in my remarks, and look forward to the discussion.
Thank you, Francisco. That was excellent. I appreciate that. All right, our fourth speaker today is Gloria Steele. Gloria is a certified emergency manager and serves as the language and communication strategy manager for the Fairfax County, Virginia Office of Public Affairs, and was formerly with the Fairfax County Office of Emergency Management as the engagement manager, where she oversaw the development of multiple resiliency programs for 1.2 million people in the county. She's a bilingual resiliency and homeland security expert. Her focus has been to enhance the preparedness culture among under-resourced communities and building public-private partnerships. She has developed over 2,000 partnerships between local government and the private sector, including Wegmans, Target, and Fannie Mae. She has led over 100 preparedness programs that have equity at its core. She has often consulted on matters of resiliency, language, access, and diversity by governmental and legislative officials to implement programs that increase access and diversity that reflect community needs. Her strategies focus on data-driven and actionable methods, and many have been implemented in other states and countries. She has a double BA in Homeland Security and Emergency Preparedness and in Political Science. And in her free time, which it doesn't sound like she has opportunity for much, she is a licensed FAA remote pilot serving the mission of the Fairfax County Unmanned Aircraft Systems Program. She is a member of the International Association of Emergency Managers Diversity Committee and is an equity lead under the One Fairfax policy in Fairfax County, Virginia. And finally, she is a 2020 Latino National Security and Foreign Policy Next Generation Leader honoree. Gloria, wonderful to have you today.
Thank you, Brian. Thank you so much, everyone, for tuning in and for allowing us to share information about this topic that really focuses on a continual commitment to provide access and to really think about individual needs versus a blanket approach. My fellow panelists have shared many of their experiences and what they've been observing across their jurisdictions and their just their time in emergency management. And I really want to focus on the commitment to take these approaches into policy and to make it a conversation with community leaders, and to really focus on how policies, procedures, plans, exercises, and everything in emergency management is affecting your community. When we say that we involve or we include the whole community in the work that we do, we're really saying that we involve and we connect with those that come to the table, that are easily accessible. What we're not saying is that we have to take an extra step to be able to connect with those who may be in the shadows because of their unique situations. And therefore, we need to connect with leaders who may be representative of their communities. The other piece is that we need to look at data. Data shows that in studies that I've done with various analytic universities or various analytic studies that I've conducted, it shows that those that are connected to our alert systems are not reflective of our entire community. And so if you pair your alert data with census data, then you will see that there are gaps and there are islands in the services and the communication that we provide to our communities. It is essential to connect with community leaders, to connect with your community outreach professionals outside of emergency management. What I've learned in gathering over 108 outreach professionals across Fairfax County is that we need to ensure that the conversation of needs, community needs that is, and the conversation of policies are at the table when we develop plans, when we think about the next exercise, and when we think about developing our outreach programs. One of the things that I urge you all to think about as you move on and as you continue your work in this area is to engage your community leaders. Your community leaders are the voice of those that have those special needs or that unique situation, and that those unique situations make up the silos and maybe what is absent in a lot of the plans, in a lot of the exercises. A lot of this effort is surrounded by having connections with community, and we're seeing it time and time again when we're looking at recovery from any disaster. We're seeing that there is issues in accessing information or not being able to reach the whole community. And that is part of the outreach effort, is to ensure that we understand as emergency managers where our communities are receiving their information and who are they trusting to deliver that information. And so it's been my experience that leading COVID communications for the multicultural and multilingual communities, I am partnering and I am ensuring that faith leaders and the media is at the table for a lot of our conversations. I often have conversations with them on a weekly basis because, again, we need to find those trusted avenues to be able to convey our message and to be able to share information that is critical to the well-being of our communities. So in closing, focus on policies. Policies are the structure and the base of the work that needs to be done. Plans and all parts of the work that we do as emergency managers need to reflect a single structure in an organization. And also have outreach professionals at the table. It is imperative that the needs of the community are reflected at the start of every plan, every exercise, and all parts of emergency management versus having it at the end when we often seek community input or community feedback based on the laws and the structure of how we are managing a lot of our work. This work needs to be, or this connection with the community needs to be done at the start so that you can ensure that your information reflects the needs of the community, that your plans are reflective of what needs to be implemented before any disaster happens. Thank you.
Gloria. All right, so fantastic presentations by everybody thus far. And so now we have about 45 minutes or so to address all of your questions from the audience. Many of you have already put questions into the chat, so I would encourage you to continue to do so. So I'm going to start working through those as well as some that I have as well. And I'm going to start with the very first question I have written down, and I'm going to start it with Chauncey and then open it up for whoever else would like to do it. And the question as written said, what does equity in disaster recovery mean to you? And then Chauncey, I'm going to give a little bit more precise question, which is in your presentation, you mentioned that a mass vaccination center may be equal, but not equitable. So describe to me specifically, if you don't mind, how an equitable vaccination center would look like, since many of the folks on this are dealing with that today, and then broader in disaster recovery as a whole. And then I'll go to some of the other panelists.
Well, that's a great question. I love that question, actually. When we're talking about equity versus equality. I think it's important to understand that those are two very different terminologies that will produce different results. So equality, there's a famous quote by Dasani, and it basically says that equality is giving everyone a shoe. Equity is giving everyone a shoe that fits. So when we think of a mass vaccination center, I would encourage you to put yourself in the mindset of someone who already lacks access to some of the most basic resources and information among us. So someone who maybe doesn't have access to a vehicle, someone who may be disabled and not able to walk well or stand for a long time, or is not a driver, or someone who has some sort of other access or functional need. Also, someone who lacks access to information, social media, someone who may not be literate. A huge portion of our population is not literate. So when we think about a mass vaccination center, think about the person who already lacks access. What you've done is you've created something that is equitable, that allows everyone, that is equal, but it allows everyone access, but it's not equitable. Equitable would be to put a vaccination center where it's accessible. So it's a more community-based approach. As Gloria mentioned, it involves actually acknowledging the communities and their needs. So if there's already a transportation challenge within that community, and you're putting a mass vaccination center miles away, which is happening over and over, and we're seeing that these mass vaccination centers are actually creating more inequity and disparities. And the numbers are not going up for people vaccinated, it's actually going down. Move yourself around, Brian, to turn on the lights.
Yeah, there we go. Thank you, got it.
So I guess that was the cue. I'm talking too long. I'm saying too much. But you know, it's really, there's another layer to this as well, because it's actually a three-pronged approach, and I won't go into it, but it requires also that foundational messaging as well to that targeted population. So it's about assuring that equity is considered, that the messaging is targeted, that the community has time to process the needs that are required to get them to the point to where they're actually being vaccinated. And many communities are setting up these centers and not doing the education. And as Director Sheehan said, it's about making sure that they are comfortable and have the trust. And that's part of the education that has to occur well before you're asking them to go to a location to vaccinate. And so it's a process, it's a phased approach to address the inequities that exist. And it can be done, and it has been done successfully. And I think the work that a lot of states have been doing that are focused on the complete equity process are doing a good job, but others, quite frankly, are setting up centers and they're not accessible to everyone. So I'll stop there.
Thank you. And Francisco, I'm going to take what she just said and relate it back to something I think you talked about. What you talked about during, I think it was Harvey, you did a walkthrough of the shelter and you thought you had set up a good shelter, but you opened yourself up to criticism, had an expert go through and highlight the things perhaps that you needed to work on. You know, I think probably a lot of that's going on with vaccine distribution and other things today. Emergency managers think they're doing a good job at achieving equity. But in the absence of being able to walk through all of those facilities with an expert, are there data points that people could be looking at to determine if they have met that goal? I mean, is there proof in the pudding? Are there quantifiable outcomes that they could point to and say, we are achieving equity or we are not achieving equity?
Yeah, and I think there are areas where that would be more where that's easier than other areas. For example, in walking through the shelter at NRG, that was really sort of going in there and with an expert, someone that knew this inside and out and was able to point some things out that we needed to do, and then sort of walking it back with the staff and that it's okay for someone to tell us we can do better, and we ought to live up to that. And metrics of that can be challenging. I think we can look for folks that are experts and tell us how we're doing those kinds of things. When it comes to testing, for example, and vaccinations, that's data we can run with. That's something we readily have available at our disposal with information from the census, what we know about vulnerable communities, comparing that up with who's actually making it through the testing sites. And if we have that kind of data, but also one of the challenges that we have in emergency management is I think a big gap is sort of collecting data, analyzing data, and being able to make decisions like that. That is a huge gap. We can partner with our public health folks. One of the things that we've tried to do going into the winter storm recovery piece is relying on some academic institutions, people that can dedicate the time to be able to do that. Many emergency management shops aren't very large. We've got a shop of 40 something, and that's probably one of the larger ones in the country, but even we don't have great depth in terms of data. And one of the things we can do is that, if we bring in folks to help us do that analysis, find a way to be able to keep those metrics and be able to sort of replicate those in the future. But that's a critically important piece, so we can match that up and at least have a sense. If we can see that there's a gap, then reach out to folks that can help us fill that gap, or at least inform our decisions a little better.
Good. Thank you, Francisco. Patrick, I got a question in the chat from Paul Hogue, and it's directed to state EMAs. So I'm going to start with you and then open it up to the rest. Does our state EMAs or related programs making an effort to recruit from underserved and minority populations, ? Are they hindered or assisted in that effort by their own state employment systems?
No, employment system hinders us. I think a lack of awareness, and I've seen some chat here, I think a lack of awareness of emergency management as a viable career field for someone is something that's, and just quite frankly, I think someone else mentioned this too, African Americans don't see African Americans in emergency management. It's by far the exception and not the rule. And that's not just true in Tennessee, that's true across the nation. And so there's a lot to be said to not being the only. And a lot of times when you're a minority, you're going to be the only person that represents your community there. And so, one of the ways that we're trying to do this here is to increase awareness of emergency management in our communities of color here. And like I said, we're trying to work with Tennessee State University and Dr. Johnson and Dr. Graham there to increase awareness and also to help build skills, right? So a prepared population is an engaged population is a more prepared population, and generating that interest, I think will help us long term. So this is, like I said before, we didn't get into this problem quickly. We got into this problem of lack of trust, lack of equity, lack of representation over generations. And I hope it doesn't take us generations to help address it, but it's going to take time. It's going to take persistence to do it.
Thank you, Patrick. Others on the panel, any thoughts about your agencies or agencies that you have seen and their ability to deal with that? And Sima, I see your hand up, so I'm gonna come to you in a moment.
So Brian, one thing that I do want to add is, so one of the things that Fairfax County OEM has done in the last year has been to really focus on ensuring that when a position is available, that we connect with our human resources folks to blank out all information, all personal and identifiable information on applications, on resumes, so that the process in hiring is equitable. And also one of the other recommendations that we put forth 2 years ago and has now been enacted as a county policy is to send out job openings or opportunities to our HBCUs, to our multilingual or multicultural networks as opportunities. And then also one of the focuses for our diversity committee within IEM has been to mentor, to have conversations at various points of young professionals' career paths, and to really showcase that there are opportunities in emergency management, that this profession really takes the multiple talents to be able to bring our products to the table. And so mentorship, discussing policies with human resources to make sure that identifiable information is completely taken out of the equation. And then also to invest in making sure that those opportunities are being sent. And sometimes there's a cost involved with doing all this, but that those opportunities are being shared with networks that may have a diverse mission.
Thank you, Gloria. Sima, I see your hand up. Before you speak, I had to go off video there for a second because somebody came to the door to inform me that they were serving cupcakes and ice cream in the EOC. So I challenge all you other state directors or county directors to match Virginia's hospitality. But with that, Sima, do you have something to add?
Oh, Brian, you're something. So yes, first and foremost, I want to say thank you. This is a fantastic webinar. It's timely. It's in a way, Chauncey, it's like you were speaking to me, because I am coming to you from a type 1 federally supported state managed site in Cleveland, Ohio on vaccination. And we kicked that off with a soft opening on Tuesday and ramping up to 6,000. And I will tell you, this site was picked specifically, it's at Cleveland State University because of its access to our medically underserved and our SVI percentages, which are some of the highest in Ohio when you look at larger groups of population. The first thing I'd like to address quickly, and I don't want to take up much time, is the state of Ohio. When our governor came in 2019, he quickly moved to put in for and challenge our Director of Administrative Services to help enhance diversity and inclusion among our state's workforce. So in the creation of a diversity and inclusion competency on our state's employees' performance system, in addition to having that for all managers to have to comply with, there was a launch of an implicit bias training and disability inclusion conference that allowed us to work and be more focused in as we moved forward in managing our state workforce. The the Division of Emergency Management sits within the Department of Public Safety in Ohio, and public safety went ahead and it started by putting in a department-wide policy, which includes our Bureau of Motor Vehicles, our Highway Patrol, some pretty large departments. Upwards of the total is 4,000 people in our department. And they put a policy around diversity, inclusion, and equity, and how we manage that in hiring and how we manage that currently among our staffing portfolios. We also, I sit on this as one of the division directors and the state emergency manager, and we have a diversity, equity, and inclusion strategic plan. And we have been doing many outreach pieces to our community, to our staffing fairs that we have within the state, to talk about how important diversity is. And our HR department, through the department and then on up to the Department of Administrative Services, is required to make some measurements as we go through these hirings. So there has been quite an active push, and very much and I don't know if I want to call it a push. I think it's part of the way we do business now. It's just how we do business. if I could take 1 second and switch to this type 1 site that we're working.
Please.
If you are working a type 1 site, it is important that you bring in the community leaders. You bring it, we have a place called Global Cleveland. We have a mix. We had no idea the extent of all of the different languages. Like we found out Nepali is quite a language here. So when we brought in language interpreters, we also brought in interpreters in person for 10 languages. And we brought in the group that could translate up to 240 languages. We have a card that is available for people to say, I speak, and they can point at what language. A lot of this may seem universal to us as emergency managers, and maybe not, but it doesn't to a lot of other folks. So we have encouraged our community leaders, our Black and Brown community leaders, to come in and publicly receive their shot. So people see that and realize we have a stationary patient model where folks come in, they sit down, they never move that seat. So they go through registration, they get their shot, and they also have their observation. Well, when that is a great experience for that client, whether your access functional needs or you just are nervous about the process, to walk outside and go back to your community and share that, it just helps the people in need who need these shots so much, feel so much more comfortable. So everything that you said, Chauncey, and anyone on here who is working mass vac sites or in anything that would have large gatherings, it is imperative that we bring in the taste of that city or that community and ensure that they have seats around the table, because everybody has a lot to add. Thank you for your time and letting me speak there.
Thank you, Sim. Those are wonderful contributions and things that I am taking notes on for use here in Virginia and other places where I'm operating. I'm gonna go back. Patrick, one of the things you talked about is you said that language is important. And I concur. And I myself, it's an issue that I have issues with. I just a couple of months ago, I do these all hands meetings, and I used to, do what I was calling attaboys to recognize great work. And several of my staff highlighted that that's probably not the best term I could use. It was, a specific pronoun. So I've changed things around. One of these questions highlighted that further to me, and it's from Maddie Leibowitz. And I'll read it. It says, what steps as employees within our organizations can we take to increase diversity and inclusion within workplaces? Specifically, what can non-POC, and this is why I highlighted to me, so what can non-POC do to be allies for BI-POC coworkers or potential coworkers? And for those of you who are like me and didn't recognize that acronym, BI-POC is Black, Indigenous, Peoples of Color. Coworkers or potential coworkers. So Maddie, thank you for helping me learn a new term today. So Francisco, I think maybe I'll ask you this one. You talked about mentorship and helping to bring up others into the organization. So how can folks so to Maddie's question, how can non-peoples of color be allies for peoples of color to coworkers or potential coworkers? Is that possible? And how do we do it?
Sure. Glad to talk about that. I'll tell you, in our EOC, we don't have cupcakes. I can just up the ante with some strawberry Pop-Tarts that keeps me going during an activation. There's lots that we can do. And I think one is be very attentive to feedback from that and create, quite frankly, an environment where people know they can come to leadership with some suggestions and to actually be responsive to those. And knowing that and really having the attitude when we get candid feedback is knowing that we're doing well or we're doing good or they're doing the best we can is not good enough. And so making sure that we're very attentive to that feedback. And I think that we have to really attract folks maybe from outside the space for not just diversity in the various facets that we talked about. We talked about recruitment in terms of bringing people that can give us that kind of feedback and contribute from those diverse perspectives. One of the things that we do is advertise our open positions outside the emergency management space, really out there in the general space. in as many places as possible to try to recruit talent. And we have to also understand sort of, I'll tell you the one thing that, and I lost my train of thought, but making sure that, it's also a place where we have limited opportunities for advancement, quite frankly. Most offices of emergency management are small. If people are coming in, there's not a whole lot of room for advancement, but making sure that regardless of that, we make sure that we train people up, we invest in them, and that's one of those things that I think we can do better. And I will tell you, for folks in leadership, that would apply to both people that are people of color or not, but especially on those of us that are. One of the things that we can do, especially those that are in senior positions, call it out when we see it. And be very vocal about those opportunities. If we're doing something that may not necessarily be, we ought to be the advocates for that. And I think Patrick had mentioned sort of the importance of language. And I'm coming up on a political line here, so I'll try not to cross it. But as we saw some of the civil protests and some of the civil unrest that we saw over this past year, how many times I would get an intelligence report, and it would talk about events with people of color was called a protest. Events that were organized by people that were not people of color were called a rally, and they were essentially the same thing. So those kinds of things, when we see those of us in the positions that can say something, one, we got to create a culture where everybody can say something and we ought to respect it. But those of us in this position, in those positions, ought to be able to call those things out and do that in a way that hopefully will institute some change.
Thank you, Francisco. And also, you have answered a question that I have been trying to solve for 15 years. Here's the question. In 2006, I joined Walmart Emergency Management. It was right after Katrina. And one of the oft-repeated tropes during that was that Walmart sold more, what was the number one thing people wanted and they prepared for a hurricane? It was strawberry Pop-Tarts. Now that I connect the dots, you were a PIO during Katrina, you're a fan of strawberry Pop-Tarts. You were the one that perpetuated that myth that has been stuck in my brain now for a decade and a half. So thank you for closing the loop on that.
Sure.
Gloria, this one I think I'm gonna ask you on, and it comes from Dave Andrews, who, for those of you who haven't seen yet, is one of my newest colleagues. Dave, welcome aboard. Dave's question here says, the term diversity is often associated with race and ethnicity. However, diversity encompasses both external and internal characteristics that make each of us unique. Diversity can be cultural, religious, based on age, disability, etc. How can we be sure to take an all-inclusive approach to diversity in emergency management?
I would say the one thing that we need to focus is to be able to educate our partners, our internal staff, and our stakeholders on the definitions, right? And then also partner. I'm huge on the partnership piece because, as Francisco mentioned, a lot of our agencies are very small. And especially in Fairfax County, where we have a population of 1.2 million, we have 18 emergency managers. So you make that math, you do the math, and there's not enough people, and there's not enough bandwidth. So it's important to connect and to develop the partnerships to be able to define those that make up the diverse communities in your jurisdiction. And to be intentional in creating, I mentioned creating the policies, creating the procedures and plans. When I led the outreach efforts in emergency management in Fairfax, I made sure that every year we were looking at a plan, that we were being able to update that plan depending on the needs and the situations that we were facing. A lot of times what we see is that we are saying the same thing over and over again to every community of making a plan, building a kit, and getting involved. And we're not looking at their unique needs. Interestingly enough, when I became a mom, I started looking at those talking points and saying, wait, that does not reflect the needs that I have, right? And when the conversation, it becomes a wholesome conversation, it becomes an everyday conversation, then we need to incorporate those talking points to meet the needs. And so diversity is really understanding what makes up your community, and talking to your partners, talking to those that are doing the work every day on the ground, whether it's your outreach professionals, your community developers, those leaders that are holding the hands of our community as they're going through such a drastic and critical time that we're facing now. Ensuring that those conversations are being had and that those conversations come back to the table and are not just, promises that are not made. Those conversations need to come back to the table. Data needs to be incorporated and policies need to be developed based on what is being shared by community members.
Thank you, Gloria. Chauncey, I'm going to come back to you. This is a question from Robert Avsek. I'll start with you and others can chime in. Many of the points being addressed by Chauncey should be included in a community risk reduction program, right? I hope you say more than just right. And if you would expound on that, please.
I say I agree. It's important as I think as emergency managers that we begin to incorporate multiple tools that will better inform our planning, our program development, and the policy creation that we have to undertake. Oftentimes, we will, be put into situations like what's happening now. When you think about the beginning of the pandemic, HHS was running that. And then FEMA took the reins, and there was a partnership that had to be created. Well, how much do emergency managers know about what public health experts do? How much do public health experts know about what emergency managers do? And so you saw these gaps in understanding and comprehension of one another's areas of expertise begin to appear. And because it was disjointed, it impacted the public. So emergency managers are great at logistics. They're great at creating programs and doing community outreach. However, how often are we using social determinants of health and incorporating that information into our emergency plans to better inform our projection of resources, to better inform our planning, our staging needs? How many of us actually know the demographics of our community? How many have created language maps? And it goes for organizations as well. You mentioned you worked at Walmart. Do we know the employees that are challenged in specific areas? Like Gloria said, perhaps we have a large number of single mothers or fathers, and they have childcare needs that must be addressed in times of disaster. Do we know the language needs of our employees, or perhaps what other challenges they may have? So that's what's so critical about being able to cultivate equity, and in doing so, we are getting to know our communities better. We're getting to know the people that we serve. As emergency managers, we are serving. So when you're serving, you're asking, what are your needs and how can I best provide to you what you need? What is the way that you best receive that? And it's oftentimes just a matter of not being informed and not being willing to change the status quo. As one of our panelists said, we often do what has been done, and then we expect a different result because we slap the title equity on it. It doesn't work that way. And it requires deep thinking. It requires that we bring in people who are equity strategists. If this isn't if this isn't what you do, there's somebody else that does this. Ask those questions. Who would do this best, and how could we get the best results? And also, a lot of organizations aren't taking the time to do the equity assessments internally so that their employees are producing good results for the community and for the clients that are served. So if your employees are showing up at work with a tremendous amount of bias, or even a small amount of personal bias, unconscious bias, and it's not being addressed, well, guaranteed they will bring that to the community. It's going to come out, especially in times of crisis or disaster. So what we have to do is be intentional. We have to hire diversity and be inclusive in our organizations and produce equity. We have to promote diversity, protect diversity, and invest in diversity, equity, and inclusion. And in doing that, we're bringing in those other tools that we commonly don't refer to or use, and we're applying that to our planning. So yes, a social vulnerability assessment, a community risk assessment, analyzing the social determinants of health, and understanding which parts of our communities have been redlined, because that impacts a myriad of things, including access to health care, including medical disposition. People who live in redlined areas are not as healthy. And I'm assuming everyone, I'll make that assumption, I'm not sure, but everyone has heard the term redlining, and they know that it's involving putting the most marginalized communities in certain areas that are high risk and less desirable. And it was done through the real estate market and loans, loans and things like that. So all of that ties together, and you must acknowledge the existing inequities in emergency management. We have to do that now. So as we go into the pandemic response, and now we're looking at what happened in Texas, we see the same people are bearing the brunt of disaster. That's because we're not looking at these disasters in a continuum and understanding that the existing inequities make the same people vulnerable to just about every disaster. We have to acknowledge that and begin to take it seriously, because with climate change, we're going to see more frequent disasters, larger disasters. And in my mind, it's simply not fair, it's not right. And we have the tools to do something about it, and we must do something about it. That's all I'll say about that.
Thank you, Chauncey. Okay, so here's I think we're going to do for this. I'm going to ask one more question, and then I'm going to go to each of you for a wrap up. Any one or 2 points that you would like to make, or choose a question on the side that we haven't gotten to, and feel free to answer that. But regardless, I'll go back to each of you for a closing statement. But Patrick, I'm going to run this one by you. And I'll read the question and I'll add a little bit more there. So it's from Mary Angeles Gutierrez. It says, how do we encourage more investment in public engagement that is ahead of program design and see the extended timeline as an investment for better programs? Patrick, I'll tie it to budget, which as a state director is a big part of your job. How do you budget? How do you encourage programs like this through your allocation of the budget? How do you talk to the legislature or the governor about it to achieve these outcomes?
I don't know that we budgeted with that kind of specificity for outreach here in Tennessee, and maybe it's something we need to look at doing. We do budget for public education campaigns. We do partner with community organizations, but I don't know that we've tackled it like that here, Brian. I don't think we did when I was in Ohio. It sounds like SEMA's made some good headway in that intervening the last 5 years. But I think perhaps that's kind of competency at the state level we need to be looking at and maybe outlining as something for new directors when they come on. Of course, 5 years, I'm not new anymore, but no, I think, it's challenging to, we don't operate in a vacuum, right? So when we talk to our general assemblies, they have their own viewpoints on things. And some words are loaded for them. Some things have become political that the data suggests should not be political. And I think that just makes it all the more challenging for us as we try to discuss and define these things. I think, in Tennessee, one of the things we pride ourselves on is being data informed and evidence-based in what we do. We take a lot of pride in our discipline in budgeting. And so the more we can put data and evidence together to show the positive outcomes of making investments like that, the better Tennessee TEMA will be, and I think probably the better our nation will be. And I think we're just now starting to have those kinds of discussions here, right? That's the value of this, is ideas that I had not considered, hearing things from Francisco and Chauncia and from you and Grelia are the kinds of things that are starters. And I think for us, the next challenge is, how do we sustain that? How do we build that catalog of evidence so that when I do talk to the governor and the General Assembly about our budget priorities in future years, how do we include that? And for me, I can't do that without without data, without evidence, without something that shows the efficacy of those programs and the existence of a problem that is intuitive, but we need to continue to define.
Good. Thank you, Patrick. Okay, so with that, I'm going to go through and do the closing thoughts from everybody. I'm going to go in reverse order from our original speakers. So Grelia, I will give you the floor first.
Thank you, Brian. Again, thank you everyone for joining us in today's conversation. I hope that you take back some of these best practices and that you continue your journey in diversity and inclusion and equity as well. The one thing that I'd like to advocate, and as we continue to respond to COVID-19, is looking at language in a different context, language in the linguistic axis in our communities. We're seeing over and over again that there is hesitancy, that there is information that needs to be conveyed in a way that government has not had to do in the past, right? We're essentially setting up doctor's appointments for people, and we are looking at having to explain the process of creating vaccines and through very simplistic ways. With that comes language. My family and myself, we're immigrants of South America. And I remember when we first came to the country back in the 90s, my father said to me, as an immigrant, you have to have your finances and your health information in your own language, right? And you have to ask for that, and it has to be provided to you. Those are two critical aspects of a person's life that needs to be well understood. And so I encourage all of you to have that conversation with your teams as you continue to respond to COVID-19. Before taking this position or being appointed as the Language Access Strategy Manager for the county, we were seeking services from contracted or from contractors, and that information wasn't being verified. Right. And so we need to go back and look at the information that we're pushing out to our communities. Is it correct? One, and two, is it paired with cultural competency? And that is a huge piece of communicating with the public. Does it meet their needs, but does it also make sense, right? And so when you're looking at your communication that you're putting out to your communities, especially in the areas where we see hesitancy, investing in human interpretation and translation and verifying that those, whether it's a member of staff or a contractor, has gone through fluency testing is imperative during this time and in any time of disaster response. The other piece is looking at your systems. We're seeing, I was tasked to ensure that the vaccination process and registration for Fairfax County, which is a part outside of the state's registration, be done in Spanish and in English. And we took a look at the systems that we were using, and we had to be very creative. And as a colleague said, we need to get to a point where we're not doing gymnastics to make these systems work for us. So with that, I leave you with with my input on ensuring that your communication, that your strategies, your plans, and all aspects of emergency management meets the need of your community.
Thank you, Gloria. Francisco, closing thought?
Sure, I'll just make a couple of points closing and just sort of moving forward, continue the dialogue. This was a great discussion. I would find an opportunity to go back and do that either at your state or local community level and invite people, external to your organization to get some candid feedback. Get better with, we talked about diversity being, more aspirational and inclusion being intentional. Put it into processes. When you have a plan, make sure have somebody read it from the equity lens, and just instill that at culture, because the more people review it and the more they know that plan is written and someone's going to look at the equity lens, people are going to start writing to that. And for those of us that are in those positions, as I said, I think it's important for us to be advocates and to call those issues out in our organizations, having been here, and support those. I will say this as a lesson: the more aggressive you are at it, and the more you get at it, and the better you get at it, you're going to get requests from the community to do even better, because people are going to see you trying, and there's something that you're missing, and that's a good thing. None of this is going to be easy. Right? This is a huge lift to make sure we get better at that. So when you get those calls to do even better because you've made progress, that's a good sign, and that should be welcome. So I'll leave it at that.
Thank you. Patrick, how about you?
First, I'd just like to say thanks, Brian, and the folks at IEM and the team at NEMA for putting this together. I think I got more out of this than the folks paying attention or listening in have. I mean, I I'm buzzing with some ideas here, but what I'd just like to say is that this is a start, right? This conversation is a start. We have so much work to do in our profession. We have so much work to do in our nation. We have so many things to heal. This last year, we had so many rallies and protests about the very real issues of disparate treatment in our country. And it's going to take lots of time and lots of effort and patience, quite frankly. And we might not always understand the perspective of the people that we serve, the people that we work with, but it's a very real perspective. It's a very real lived experience. And I think it's just going to take those of us that are blessed to be in positions of leadership, giving them voice and giving them opportunity to speak and be heard, and then to listen to them and act on it in a way that is disciplined and persistent. And for me, I know one of the things I'm going to have to do now is try to find a way to build a book of evidence about how these things have real impacts on people's lives. And I think that's something hopefully that the NEMA team will help with moving forward. And again, just grateful to be a part of this panel and to have an opportunity to be here. Thank you.
Thank you, Patrick. All right, Chauncey, you're the only thing standing between me and those cupcakes. What do you want to leave us with?
I say leave those cupcakes alone.
Oh, come on.
No, I just want to say thank you so much for the opportunity to present with such a fine group today and to participate in this outstanding discussion. And as Director Sheehan just mentioned, this is about real people. These are real people. These are real families, and we need to really consider that it's their survival and their perspective that is most important. When you do the most for those who are most vulnerable, everyone benefits. And so to continue to leave out those who are most vulnerable, or to not purposely include and intentionally create equity is a shame. And it is an indictment. So as we close here today, I just want to say that would be my one thing, is to consider the people. We want to make sure that everyone is considered and their needs are prioritized along with you and your family's needs. So thank you, and please contact me if you have any questions. And I definitely enjoyed this time with all of you today. Thank you.
Thank you, Chauncey, and thank you, Patrick. Thank you, Gloria. Thank you, Francisco. Thank you, Sima, for the guest appearance. Thanks to all of you for joining us today and the wonderful, thoughtful questions, the majority of which we did not get to, but which I hope you all have perused and consider as you digest this in the days and weeks and years ahead. Certainly some great things to think about. So thank you everybody for joining us. Matt, is there any closing things we need to do before we wrap this up?
No, Brian, just wanted to thank you and the whole team at IEM and all of the panelists. I think it was a great discussion today.
All right. Thanks, everybody.
Take care.